Sexual and reproductive health is a critical component of overall well-being, yet many genital infections remain poorly understood. One such condition is Actinomyces genital infection, a rare but clinically significant bacterial infection that can affect both men and women. Actinomyces species are anaerobic or microaerophilic bacteria that are normally present in the human body, including the oral cavity, gastrointestinal tract, and female genital tract. While these bacteria are often harmless as part of the normal microbiota, under certain circumstances, they can become pathogenic and cause genital infections. This WUTNews video provides a comprehensive guide on Actinomyces genital infection, including the history and discovery of Actinomyces, how Actinomyces causes genital infection, symptoms in men and women, risk factors and prevalence in different countries, transmission and routes of infection, diagnosis and laboratory testing, treatment options and antibiotic therapies, prevention strategies and protective measures. Understanding Actinomyces genital infection is crucial because early detection can prevent severe complications, including pelvic inflammatory disease, reproductive tract abscesses, and infertility. Subscribe to WUTNews to stay informed about rare genital infections, sexual health, and reproductive health education. Understanding Actinomyces bacteria. Actinomyces, a genus of gram-positive filamentous bacteria. These bacteria are unique in that they can act both as commensals, harmless inhabitants of the body, and as opportunistic pathogens when the normal mucosal barriers are disrupted. Key characteristics of Actinomyces species include gram-positive, branching filamentous rods visible under microscopy, ability to form abscesses and sulfur granules in infected tissues, slow growing, often requiring special anaerobic culture conditions, association with polymicrobial infections, often alongside other anaerobic bacteria. Actinomyces is most frequently identified in the female genital tract in association with intrauterine devices, IUDs, but it can also affect men and women without such devices under certain risk factors. Historical background. Actinomyces bacteria were first described in the late 19th century, with initial cases reported in oral and cervicofacial infections. In the early 20th century, Actinomyces infections were increasingly recognized in the abdomen, thoracic region, and female genital tract. The association between Actinomyces and IUD use was first observed in the mid-20th century, leading to increased awareness of genital actinomycosis as a rare but serious infection. Despite being known for decades, Actinomyces genital infection remains underdiagnosed due to its slow growth, nonspecific symptoms, and polymicrobial nature. How Actinomyces causes genital infection. Actinomyces genital infection occurs when these normally harmless bacteria breach mucosal barriers and establish an infection. Disruption of normal genital tract defense mechanisms allow the bacteria to overgrow and invade tissues, causing inflammation and abscess formation. Triggering factors. Use of long-term intrauterine devices, IUDs, in women, poor genital hygiene, trauma or surgical procedures in the pelvic region, pregnancy or postpartum changes, immunocompromised states including chronic illness or medication-induced immunosuppression. Once infection is established, Actinomyces can cause chronic inflammation, formation of pelvic or genital abscesses, and fibrotic tissue development, potentially complicating reproductive health. Modes of transmission. Actinomyces is generally not considered a classic sexually transmitted infection. Infection occurs primarily through opportunistic overgrowth rather than direct sexual transmission. However, sexual activity can contribute indirectly by altering the normal genital flora or introducing other pathogens that facilitate Actinomyces proliferation. Key modes of infection include disruption of mucosal barriers in the genital tract, long-term IUD use creating a microenvironment conducive for bacterial growth, minor trauma or surgical procedures in the pelvic region. Symptoms of Actinomyces genital infection. Symptoms may vary depending on the site of infection, severity, and presence of co-infecting bacteria. General symptoms: chronic pelvic or lower abdominal pain, unusual vaginal or urethral discharge, foul-smelling genital odor, fever or malaise in severe cases, swelling or redness in the genital region. Symptoms in women: pain during sexual intercourse, vaginal bleeding unrelated to menstruation, pelvic masses or abscesses detected by ultrasound or physical examination. Rarely systemic symptoms if infection spreads. Symptoms in men: urethral discharge or irritation, painful urination, swelling or discomfort in the genital area, rare abscess formation in severe cases. Many cases are asymptomatic in early stages, making routine gynecological or urological examinations crucial for early detection. Complications of untreated infection. Untreated Actinomyces genital infection can lead to serious complications: pelvic inflammatory disease, PID, reproductive tract abscesses, infertility due to scarring and fibrotic tissue formation, chronic pelvic pain, rare systemic infection if bacteria enter the bloodstream. Early diagnosis and treatment significantly reduce the risk of these complications. Global prevalence. Actinomyces genital infection is rare worldwide, but prevalence is higher in regions with long-term IUD use without regular monitoring, limited awareness of reproductive health, limited access to advanced microbiological diagnostic facilities. Despite its rarity, awareness among healthcare providers and patients is essential to prevent misdiagnosis and delay treatment. Diagnosis. Diagnosis requires a combination of clinical evaluation, imaging, and laboratory tests.
detailed medical and gynecological urological history, physical examination for pelvic masses, swelling, or abscesses, laboratory testing, including anaerobic cultures to isolate Actinomyces species, imaging studies, ultrasound CT scan to detect abscesses, histopathological examination to identify characteristic sulfur granules. Because Actinomyces grows slowly and often exists alongside other bacteria, accurate diagnosis can be challenging and requires specialized laboratory techniques. Treatment options. Treatment focuses on antibiotic therapy and, if necessary, surgical intervention. High-dose penicillin is the first-line treatment. Alternatives include doxycycline, clindamycin, or erythromycin for penicillin allergic patients. Long-term antibiotic therapy, 6 to 12 months, may be required for severe infections. Surgical drainage may be necessary for abscesses or extensive tissue involvement. Removal or replacement of IUDs in affected women. Prompt treatment resolves symptoms and reduces the risk of serious complications. Prevention strategies. Preventing Actinomyces genital infection involves maintaining genital health, hygiene, and timely medical care. Regular gynecological and urological checkups, proper hygiene and safe sexual practices, careful monitoring of IUD use including regular medical visits, prompt treatment of minor genital injuries or infections, strengthening the immune system through healthy diet, exercise, and stress management. Awareness is key, as early detection allows for effective treatment and prevention of long-term complications. Why awareness matters. Actinomyces genital infection, while rare, highlights the importance of understanding opportunistic genital infection. Knowledge of its symptoms, causes, and prevention helps individuals detect infection early, seek timely medical attention, protect reproductive health, prevent complications such as PID or infertility. Public education and awareness campaigns, such as those offered by WUTNews, play a crucial role in reducing the impact of rare genital infections. Conclusion. Actinomyces genital infection is a rare but clinically important condition that can affect reproductive health worldwide. By spreading knowledge about its causes, symptoms, diagnosis, treatment, and prevention, we can encourage early detection and improve health outcomes. Subscribe to WUTNews for more videos on rare genital infections, sexual and reproductive health, STIs and STDs, global health education. Like, share, and comment to help others protect their reproductive health. Stay informed, stay safe with WUTNews.